Joining us now is Sean Trainor, flight nurse and paramedic on LifeStar. Sean, thanks for being with us today.
Thanks for having me.
So tell us about the role LifeStar is playing during this COVID-19 pandemic.
So LifeStar's, we've been providing critical care transport for these patients. So if the patient needs a higher level of care, we're providing that service by air. We have critically trained paramedics, nurses, and respiratory therapists who can meet the needs of these patients who sometimes are very, very complicated.
And Sean, tell us, I asked you earlier on the media briefing, the difference between an ambulance ride and LifeStar. Is it the level of care these patients need so badly and how LifeStar provides that?
That is correct. So the patients that we take sometimes are past the level of capabilities that the facility can handle. So, you know, sometimes we have patients that are on multiple infusions of medications to support their blood pressure, support their breathing by ventilator, and sometimes these ventilator settings are pretty advanced and require more of an expert kind of clinician for the transport.
And you guys just did your first ECMO transfer. Tell us what that's a pretty high-level machine, a support machine. True.
So ECMO is extracorporeal membrane oxygenation, which is basically a way of oxygenating somebody outside of a ventilator, so the patient is able to rest their lungs. So we will have them on a machine. Dr. Gluck is the team who heads the team here for Hartford Hospital. Will go out and sometimes cannulate these patients, and we're able to provide this oxygen able to oxygenate them through the machine versus using that ventilator, because their lungs become so difficult to ventilate and they become kind of stiff in a way.
All right, amazing. Your team is amazing. How are your crew members holding up, Sean?
So we're holding together pretty well. We have a great support system from the top to the bottom. On a crew level, we support each other. If I am coming on shift, and this has happened a number of times where there are transports waiting for us when we get there, the off-going crew is making sure that our equipment is prepped and ready to go. We do the same on the other end. If a crew is coming back late, we make sure that we're there to decontaminate and kind of take some of their tasks away from them, allowing them to complete what they need to do, making sure that they're able to complete the paperwork and get themselves changed into clothing that's not soiled. So we, on a crew level, support each other pretty frequently. Leadership is very supportive of what we do and making sure that we have all the right equipment, the proper PPE, and so it's a big team effort, and we're going to get through it.
All right, Sean Trainor, we thank you for taking the time to keep us up to date, and your crew, you guys are amazing. Sean is flight nurse and paramedic for LifeStar. Thanks for being with us today, Sean.
Thank you for having me.